Hi guys, I'm so sorry. I was having a little bit of technical difficulties with the streaming service, but my name is Rachel. I'm so excited to meet everybody. I'm so sorry for those of you who are probably having a little hard time finding the video, but we are now officially live. And my name is Rachel. It's so nice to meet everybody. This is my childbirth masterclass, and we're just gonna go over pregnancy, childbirth, a lot of great topics that I'm sure you guys want to know all about. So the great thing about this class is that it is very interactive. So you can feel free to ask questions, use the live chat. You can comment in the live chat whenever you have any questions about the class. And I will be more than happy to help you and answer and support you in any way that I possibly can. So to start off, my name is Rachel. I am from South Florida. I'm a lactation nurse. I'm also a registered nurse. I work in the hospital, so I have a lot of great experience with breastfeeding and helping moms. And I just decided to make this class to try to help those around me, just to kind of be a support for parents right now who are definitely looking for some resources and support. So that's why I started this class, and it is such a pleasure to be able to help everybody. So we are starting with the Childbirth Masterclass. Now, this is actually my Childbirth Masterclass live. I actually have online on my website as well, mommydidyouknow.com, that goes over all of this and plenty more as well. So it's very exciting. Now, to start off, we're going to talk about pregnancy and what to expect in pregnancy. Of course, everybody goes through a little different changes with everything, but for the most part, most people end up having a little bit of morning sickness in the beginning, and that's perfectly normal. What really helps is, for me, if I try to suck on a lemon, or I try to keep away from acidic foods, drink more water, and that really helps with the morning sickness in that way. Then some people also get heartburn a lot. What really helps with heartburn is try to keep away from acidic foods as well, and try also not to eat too soon before going to bed. That's one thing that I noticed, is that if I try to eat right before going to bed, sometimes I get that heartburn. And I think it's only, sometimes people say that if the baby has like a full head of hair, that they will have a lot of heartburn. I honestly think that's a little bit of a, I don't know if that's true or not. I mean, it could be. I didn't have that much heartburn, and both of my kids had a lot of hair. So I guess it depends on the person. Then on the second trimester, a lot of people say that they have a lot of nasal congestion. If you do have a lot of nasal congestion, just make sure that you are not using Afrin nasal sprays. If you want, you can use really gentle, like saline drops. Those work very well. It's just Afrin sprays. What I heard is they actually can be very detrimental for your heart, and they actually can really mess up with your body. So definitely those are different things to think about as well. Braxton Hicks are also false contractions. Sometimes you might start getting those sort of in the second trimester. So I know that we have a few people that are in right now. And for the chat, you guys can tell me, how do you know the difference between true labor and false labor? So I'm just going to say a comment in the chat. That way you can see that this is me. This is Rachel. So we have a few people that are watching. So you can say if you know what is the difference between true and false labor. So this is kind of a great way that we all can get to learn from each other, be interactive. But true labor actually is regular, it's more constant. False labor, what you'll notice is that it is irregular, and it does not really go away when you start resting. I see a few people are having some difficulties logging on, so let me try to, I'm just going to message the people so that they can see. The stream. In the meantime, while I'm trying to respond to help everybody get onto the stream, you guys can say where you're from and how many weeks are you. It is a pleasure to meet everybody. I'm so sorry about the technical difficulties that we had in the beginning of the class. All right, let's see. All right, there we go. Perfect. Okay, good. At least you were able to log on by searching for my channel. Yeah, what happened was in the beginning, the video link that I was going to use, the stream actually failed to connect the streaming service to the YouTube video that I was going to go on. So then it ended up kind of being a mess in that way. But at least I know this was my first time kind of streaming through YouTube. So at least I know for next time, maybe I'll put the link to my YouTube channel instead of to the YouTube video, because then if the streaming service fails to connect, everybody just ends up kind of like, okay, where do I go? But you were very smart, Elizabeth, to know that you can search on the YouTube channel and then see that I was doing a live event there. So it works for you. And then we have Chicago, Illinois, 33 weeks. We also have Arizona, 37 weeks. I noticed that a lot of people tend to be towards the end of their pregnancy, which is great. And it's kind of a way that you can answer all of these questions that you have about your pregnancy and your delivery. And I know that I will be a support for you guys. For the people that are on right now, are you also students of the online class that I have? Either I have the free prenatal class, I have a breastfeeding class, and I also have a childbirth class that's very intensive as well. So sometimes it really helps to take the online class as well, and then you can help to kind of reiterate what you've learned. But you can always go to as many of these live classes as you want, because I leave it open to everybody that needs it, just so that at least I can be a support when you need it. And also sometimes your questions change week to week, you know, so let's say you Jody's 37 weeks, but let's say you're 39 weeks coming up, and then now you're like, okay, well, I'm going to be having my baby pretty soon. Maybe you can help me with these questions about that. So that's why I have this open to anybody, and everyone can watch whenever they want. And I also have more videos on the YouTube channel too. So for those of you who just came in, I know that we had a little bit of a delay because of a problem that I had connecting the streaming service to the YouTube. I'm so sorry. I'm not a very tech savvy person, but I try to be because I want to be able to help you guys. But I wanted to let you know just a few changes that you'll notice during your pregnancy. We talked a little bit about nausea. I mentioned how you can help by actually sucking on a lemon helped me. I remember when I was pregnant with my first baby, I worked night shift, and then in the morning I would get so nauseous as I'm giving a report, and I literally had a bag of lemons that I would have to use and suck on in order to kind of feel better with my nausea. So that's very, very common. And you guys can also mention things that you sometimes go through during your pregnancy as well. I also dealt a lot with nasal congestion, but what you don't want to use with that is the Afrin sprays, because they can really affect your heart. So that's another thing to think about. But humidifiers really work, and so does saline drops. So those are all really helpful. And I see that some people have gone through the online courses, so that's very exciting. I made them really hoping to be able to help you guys, and it's nice because you have access to it 24/7. So I'm glad that you guys liked it and wanted to learn a little bit more. So our next topic, and this is the PowerPoint that you can find on the description as well. You can see the PowerPoint. So as obviously you move towards the end of your pregnancy, and a lot of people actually, they're towards 30 weeks to almost delivering like 38 weeks. Who can tell me when your baby is considered term? There's early term and fully term. When is your baby considered early term? And you can look at the PowerPoint if you want, but when is your baby considered early term? And then you can type it right in the box. It's just a great way that you can kind of make sure that you're paying attention. So we have, yes, exactly. So Renata, Elizabeth, So early term is about 37 weeks. Your baby is considered early term. And that aspect, the baby's probably going to be coming out breathing well, probably will be eating well, and usually will be able to stay with you in your maternity ward. Sometimes what you'll notice is in labor and delivery, you'll be in one section, you'll have your baby deliver, and then you'll end up probably in postpartum. So that's actually where I work, is postpartum. 39 weeks is actually considered fully term. So that's when the baby is completely cooked, doing pretty well. What you'll notice also is if you are less than 35 weeks and the baby delivers, there's a very good chance that your baby will end up going to the NICU for that time. That's usually when anything less than 35 weeks is usually kind of an automatic admission to the NICU. But 35 and 37 weeks, as long as your baby is breathing well and your baby is eating well, you will normally be able to stay with your baby. It's just the two big indicators are breathing and eating. And then anything 39 weeks and above is fully term. And if you guys have any questions about anything, you could always just type it up and I'll be able to answer for you guys. So your typical prenatal visit schedule, I know that you guys sometimes seem like you are visiting the OB a lot, but it's very important to keep up with all of your visits. The major one is the initial prenatal visit. What you'll see is your initial labs, your rubella screening, they'll do HIV testing, they'll do your hepatitis B testing. If you have any questions about any of those specifically, you can always let me know, or you can even email me at mommydidyouknow@gmail.com. I'll be more than happy to help you out with that as well. As you go down your pregnancy, I know that a few of you guys are towards the end, and after 36 weeks, you'll probably also have a GBS test, which is a group beta strep test. And who can tell me what that is for? So you can type on the chat if anybody knows what group beta strep, the GBS test, what is that for? And that is actually a vaginal swab. That test for group beta strep is a naturally occurring bacteria that's in the woman's vagina, in that vaginal area. So what you'll see is that sometimes, and if an adult female has it, it is not that big of a deal. However, if a baby were to have group beta strep, it can be very harmful to them and it can possibly even cause infections. So that is why if mom is GBS positive, sometimes you might have to have additional antibiotics in addition to the normal stuff that you would be having in the hospital. So basically, the biggest thing is you'll probably have antibiotics before, and then if for whatever reason you cannot have the full treatment of your antibiotics, which is normally two doses of the antibiotics, which is normally ampicillin, sometimes your baby might be at an increased risk of infection, and then they might have to do extra tests on the baby. But we hope that they don't have to do those tests. That is just if for whatever reason you're positive, and let's say your delivery goes by really fast and you can't have the treatment. Then there's also the glucose screen, which they do about 24 to 28 weeks. And then that's for gestational diabetes. And that's very important to know as well. If you are, for whatever reason, your glucose test comes out of norm, it is not that big of a deal. It's very, very common. However, it is very important that you stick to the treatment that is needed for your body. So normally it is treated very well with diet and exercise changes, but sometimes you might need medications. So if for whatever reason you're gestational diabetic, or your glucose level turns out to be a little abnormal and they are recommending for you to have diet changes or check your sugar levels at home, make sure that you are following up with that, because the last thing that you want to do is have a controllable complication end up uncontrollable because you're not taking the precautions that you should. And gestational diabetes, if you don't look out for it, or sometimes you can do everything that you're told, but sometimes still it goes out of whack. It can cause babies that are a little bit larger for gestational age. It can also cause premature delivery as well if the blood sugar gets way too high, too fast, very uncontrollable. Sometimes they might even have to induce, or they might even have to deliver you quicker. So those are just different things to think about. Then your typical prenatal exams, we did mention group beta strep. We mentioned your GPS cultures as well. So for some ultrasounds, we do a bunch of different types of ultrasounds when you're pregnant, but the transvaginal ultrasound is usually the type of ultrasound that they do in the beginning, because normally the baby is very small, there's not much amniotic fluid in the beginning, so they have to do a transvaginal one. For that one, you want to make sure that your bladder is full. So that's the biggest difference with a transvaginal and an abdominal ultrasound. With the transvaginal ultrasound, you want to make sure you have a full bladder. That way they'll be able to see the baby as easily as possible. With an abdominal, that's the one that they normally do when you just go to the doctor's office. They do a quick checkup and they're looking to see the baby's position and your amniotic fluid level, all of that. A biophysical profile is a combination of, and this is just different types of ultrasounds here. A biophysical profile is a combination of an abdominal ultrasound. In addition, they're looking at the fetal heart tone. So they're actually going to put you on the monitor. They're going to see the reactivity of the baby. And then if the baby is reactive and the baby looks good from the ultrasound, they will say that you have a good biophysical profile. It's normally what I see is 8 out of 8 or sometimes 10 out of 10, depending on the state you are in. In Florida, it's 8 out of 8. So that's if you have reactive and everything else is looking good with the baby. Sometimes they might send you for biophysical profiles if you are, let's say you're 40 weeks, your post dates, and they want to make sure the baby is doing okay, or if you had any issues with feeling the baby move or anything like that of those nature. So prenatal complications, we mentioned a little bit about gestational diabetes. We talked about that usually the treatment is diet. It normally does go away on its own without having to do much, but just in case, you might even have to have insulin injection or pills. Insulin is very short acting. It normally does not take very long to kick in. So that's why it's very, very important you check your sugar levels before you take insulin. That's one situation I see a lot of patients get themselves into, is that they get into the system of, okay, I'm going to take my insulin, I'm going to eat my breakfast, and then everything will be okay. And they just continue the schedule. But what happens if your blood sugar is low already, and then you take insulin? It can bottom out your blood sugar. So make sure before you take any medications to regulate your blood sugar or even your blood pressure, that you are actually checking your blood sugar beforehand, just to make sure that you're not going to bottom yourself out, because especially low blood sugar levels can be very, very harmful to you guys. Then some symptoms of high blood sugar: thirst, hunger, fatigue, and then of course high blood sugar. Thirst, hunger, fatigue, that's kind of all symptoms of being pregnant. So that's also another thing to think about as well, is this just I'm pregnant and I'm fatigued, or is that, do I have high blood sugar? So just keep things like that in mind as well. And that's why it's very important. Follow up with your OB visits as well. I noticed that your OB visits right now, because of the whole coronavirus thing, a lot of them are doing an alternative OB visit where they might do an in-person visit and then they'll follow up with a virtual and then go in person and virtual. And that is fine as well. You know, it's just whenever you do have those in-person visits that you make sure that everything's okay with your vital signs, and if they are checking your, if they're checking your urine, what might happen also is sometimes they'll do urine tests and they'll check for protein in the urine. That's for preeclampsia and high blood pressure, which is actually the topic I'm going to go into next, is high blood pressure and preeclampsia. So some symptoms of high blood pressure, and one thing to think about too is that high blood pressure is actually a silent complication, because sometimes you might not even notice that you have high blood pressure issues until your blood pressure is very, very high. So that's another thing to think about. So some other symptoms of high blood pressure is blurred vision, headaches, stomach pain, swelling, and then some complications. If your blood pressure were to get very, very high, very fast, you might have to have early delivery or medications to treat that. So those are all just different tidbits about high blood pressure. So I know we have a few people in the YouTube group, and I want to make sure that you guys were paying attention for our pregnancy section. So I'm going to ask a few questions and you guys can just answer with what you remember for the class. And you can go with, if you're on the Facebook group, you can comment as well. So my first question, just to kind of recap before we go to labor and delivery, because that's a whole other ballpark is labor and delivery. My first question is, at how many weeks is your baby considered fully term? So at how many weeks is your baby considered full term? And this is very important to know as well, because before your baby is considered fully term, they normally will not induce you or schedule your C-section. So yes, we have Jody, Renata. I'm so excited you guys are listening. So 39 weeks is considered fully term. That's important because at fully term, that's when your baby is going to be able to kind of withstand life outside of the womb. So that's when you'll be able to have your inductions and your scheduled C-sections. If you have complications such as high blood pressure, gestational diabetes, that they're a little nervous about going to full term, they might end up inducing you or scheduling you for a C-section earlier than that, around 37 weeks. Especially with preeclampsia, if you have preeclampsia, you might end up being induced at 37 weeks, but it all depends on that. And then my other question for pregnancy is mention one kind of difficulty of pregnancy and what you can do to help that difficulty. For example, nasal congestion. What can you do for nasal congestion? Nausea. What can you do for nausea? We didn't mention sciatica, but sciatica. What is one thing that you can do to help combat sciatica? So this is one way that you can kind of mention a complication that you might be going through as well, and then along with something that might help other people that are going through it. So for me, I didn't mention sciatica before, but I had sciatica really bad when I was pregnant, and that's just kind of like a sharp pain that goes up and down your pelvis all the way down pretty much to your feet. And what really helps that is support. So my question is, what is another complication of pregnancy or another kind of uncomfortable thing about pregnancy and something that you can do? Yeah, so Jody says that she has heartburn and she basically has to live off of Tums. So at least Tums is one of the things that they can say that you can take in moderation. One other thing that really helps for heartburn is teas, staying away from acid, staying away from acidic fruit even, and then drinking water and trying to wait before laying down after eating. So thank you for sharing that, Jody. Now let's go into labor and delivery. I know that's what everybody really wants, to make sure that they are prepared for their labor and delivery as they are getting ready for their child. So I know that it can be a little difficult to distinguish hard labor and false labor. So I just want to go over just some signs of true labor. So first of all, Braxton Hicks is also called false labor. So these are kind of like practice contractions. One thing to notice about practice contractions versus true labor, practice contractions are normally, you can normally breathe through them. That's a pretty big thing. And then another thing is that they're usually irregular, while regular labor, true labor is normally very regular in consistency, and then the frequency starts to decrease with time. So let's say it's 15 minutes, then it's 10 minutes, then it's 5 minutes. hopefully you're getting towards the hospital when it's like 2 to 5 minutes. You definitely want to be there at that point. Braxton Hicks tend to be irregular. So it might be, let's say 15 minutes, you might start feeling that tense. And then 30 minutes goes by, you might feel it again, or sometimes it can even be frequent. So just because you have frequent contractions does not necessarily mean that it's true labor. Sometimes you can even have Braxton Hicks that are, let's say 5 minutes, then 10 minutes, then 5 minutes, but they're very small. They're not causing cervical dilation. That's another thing. Usually Braxton Hicks does not cause cervical dilation. It does not cause cervical change. True labor would cause cervical change. And then especially if you are 4 centimeters dilated and above, that is considered active labor. Anything between 1 and 3 is kind of your starting labor, but at least your body's kind of priming itself. And some people can even be between 1 and 3 for a while. Like for me, I actually was at 2 centimeters dilated from 36 weeks to 39 weeks with both of my kids. So that's another thing to think about, is just because you're dilating does not necessarily mean that you are actually going to have your baby right then and there. So sometimes it might take a little bit. And then true labor, what you'll notice also is lightening, is your baby starting to move closer to the pelvic canal. It's going to start engaging in the pelvic canal. You might also have a little bit of a bloody show. Your mucus plug can even come out. If you are ever having any discharge, if you think it might be your amniotic fluid, if you think it might be whatever other fluid, make sure that you tell the doctor and you're keeping notice of any odors as well. So if it has a foul odor, you want to keep that in mind. If your amniotic fluid breaks and it has a different color, normally amniotic fluid should be clear. Sometimes it might be bloody, but if it is not clear, if it has a dark tinge to it, especially if it's a black tinge to it, you definitely want to call your doctor and make your way to the hospital right away, because that can be signs that your baby might be in distress. So if your amniotic fluid, if your water breaks and it has a different color, that is definitely a reason that you would want to go to that emergency room really fast. Let your doctor know, hey, my water just broke. I'm on my way to the hospital. It had this, different color. What that is if your amniotic fluid has a darker color, that can be actually meconium, that your baby, if sometimes when babies are in distress, they might poop actually as you are in labor, and that can be a sign of distress. Then regular intense contractions obviously is another sign of real labor, especially if you cannot breathe through them. Another thing too that I didn't mention in the last class that I had, but a lot of times true labor actually comes with back pain, just because especially as the baby is making its way down the pelvic canal, you might notice some back pain as well. Then some hospital bag checklist. Hopefully by the time you are in labor, hopefully your bag is set up. But most of the time, you don't need to bring as much as most people bring in their hospital bag. The biggest thing to think about is comfort for mom and comfort for baby. It's comfort things. So while you are in labor, sometimes you might want some essential oils, you might want some aromatherapy. If you are planning on using a birthing ball, you might want to use that as well. If you're going to the birthing center, sometimes they might have birthing balls available for you guys as well, or peanut balls. I know in my hospital, we do have a peanut ball, so you don't really need to bring too much. But some people do like to bring aromatherapies. Some people even put it on like a cloth so that they can smell it as they are in labor. A fan is fantastic as well. Like sometimes they have these handheld fans that you can use, or even a little washcloth for your face. Those work wonders as well. For mom, you would want to bring some comfortable clothes for, especially after you deliver. That's one thing that a lot of people don't really think about. But even after you deliver, you want to get out of that hospital gown when you can, because you don't want to be stuck in that hospital gown all day. You want to make sure that you are out of the gown, that you are becoming more independent, getting out of that bed, because the last thing that you want to do is have a baby and stay in the bed all day. You want to be active, you want to be up as long as you are tolerating it. Now, if you are super dizzy and you lost a lot of blood in the delivery and you cannot tolerate standing up for long periods of time, then that's not for you. But if you can tolerate it and everything went fine and there were no complications, you want to try to get up. And that goes for cesarean births as well. After you have a cesarean, normally it takes about 6 to 8 hours for you to adequately start feeling your feet if you had a spinal. And it is good to start walking. Normally after I get a C-section, I'll try to get them walking about 8 hours or so after their delivery. And I try to take the catheter out as well. You will probably have a catheter if you have a C-section, most likely, just because you can't move your feet. And then also you might also have a urinary catheter if you had an epidural. That is because during the epidural, unless you have a walking epidural, you normally will not be able to feel your legs that much. So that is another thing to think about as well. With catheters, if you have an epidural, you can request to have the catheter placed after your epidural is in or after your spinal is in. You can call your hospital ahead of time to ask what their procedure is. I know that in our hospital, normally we prep the patient and before they go into the recovery room or slightly before, so they might end up having to put the catheter before you go into the OR, but you can also request to have the catheter in after your spinal is placed or after your epidural is placed, because I know that sometimes people can be a little nervous when it comes to having a catheter. But what's very important is try to, as long as your output's okay, so normally anything 30 an hour is minimum. It's very, very little. But if I have a patient that's, let's say, 50 or 100 cc's of urine an hour, I'll normally be able to take out their catheter after about 8 hours or so. They'll say 6 to 8 hours. I normally take it out around 8, as long as the output's okay. And then you'll normally want to try to urinate very soon after that, definitely within 6 hours or so, because you don't want to wait too long, because after you deliver, if your bladder's too full, it can cause more contractions and it can cause more bleeding as well. So to go back into that hospital bag, the biggest thing was you want to think of comfort for mom. You want to bring your clothes, you want to bring a comfy pillow or a comfy blanket. For the baby, they do provide clothes, but sometimes the clothes are not that great, honestly, that they'll give you in the hospital. So sometimes you might want to bring your own clothes, and that's completely up to you. And then another thing that I do recommend is to bring also your prenatal records. Sometimes your doctor might not send your prenatal records to the hospital, and that is actually very important to help prevent certain tests that we might have to do if we don't know your record history. So for example, let's say you had your prenatal records and you're negative for everything, but you go to the hospital and you don't have any of those records. We might not know your HIV or hepatitis B or GBS status, and then we might have to do all of those tests over again to make sure that you are negative for all of those. So that's extra tests for you. Then on top of that, it might be extra tests for the baby. So let's say we don't know your GBS status. You'll end up having extra antibiotics when you could have had your prenatal records. Sometimes you can even access it online, which is fine if in the meantime we can have an online record until we can get those records from the office. But it is good to have your prenatal records with you, your prenatal history with you, especially if they saw anything in your history that was a little out of the norm. It is very good to try to hopefully be able to have those records with you. Now, another very important topic that I want to go over are vaginal exams. So I know as women that are getting close to delivery, that are getting close to childbirth, sometimes we are a little bit too open with what we let happen. We need to be more active members, active participants of our healthcare. It's not good enough just to have someone come in, say, oh, I'm here for some blood work. Here, take my arm, and let them do whatever tests. No, you want to be an active participant in your healthcare. know what they are doing, know why they are doing it, and know what are the indications if something were to be out of the norm. Those are all very important to know. So for vaginal exams, one thing we're looking at is dilation. Normally, when I will ask somebody, oh, what do you think they are doing the cervical exam for? What are they checking for? They'll normally say, oh, it's a dilation. But in addition to the dilation, it's also a wide variety of other things as well. So how open or wide is the cervix? Sometimes you might start dilating as you're closer to delivery. Sometimes you might even start dilating even in your, let's say like for me, for example, I started dilating when I was 36 weeks pregnant. Didn't mean that I was in active labor. It just meant that my body was starting to get ready for delivery. That when I actually delivered, at least it only took a little bit of a kick and then I was able to deliver. My first pregnancy was very different though. My first pregnancy, I was in labor for a long time, but my second pregnancy and my second childbirth, I was pretty much 36 weeks. I was already pretty much 2 centimeters dilated. Then I went into labor on my own. And by the time I came to the hospital and had my baby, it was literally like 5.5 hours and that was it. But I know some people that deliver in the car or they deliver at home. So everybody is different because some people will have a very long delivery and some people will have a very short delivery. So it really depends on the person. And even your first baby, some actually last week, I even had somebody that it was their first delivery and they ended up being delivered in the car. So just because it is your first baby, it does not necessarily mean that your pregnancy and your labor will go for a while. That's why it's very important. Try to breathe as much as you can. Try to be as rested and try to be as calm as you can because stress kind of prevents you from progressing. So in addition to dilation, we also have ripeness, is how soft. Your cervix needs to be very soft in order for dilation to occur. If it's not soft, and let's say you are 39 weeks, you're going in for your induction, they might have to have a cervical ripener that will help you dilate for your delivery. Sometimes you might even go into labor naturally from that. One thing to know about that is let's say you are being induced and they need to ripen your cervix first. The biggest thing with that is that your induction will be a little bit longer. So let's say you were coming in, you needed to be ripened first. You'll probably come in around 7 p.m., 8 p.m., and then you'll probably deliver in the morning. Sometimes it takes a little bit longer. They will see how the cervical changes. Sometimes you go into labor naturally from it. Sometimes they even need to put in a second dose. That is kind of, it takes time and it really depends on the person. What exercises is good to stimulate dilation? So number 1 is breathing. Number 2 is staying calm. One thing that is very important with dilation is actually your body has to be very calm in order for you to start dilating. One breathing exercise, I was going to go over this a little bit later, but one thing that you can do for any exercise that you do for breathing, you always want to find a focal point. So let's say you are in your room and it is the clock. It is a focal point for you. Or let's say it is a family member or a friend, a focal point that you can focus on. Then you want to think in your head something that you can say. Let's say 1, 2, 3, 4. But you can actually say in your head, you go in through your nose, out through your mouth. I'll normally say 4 and 4. So you'll normally pick your focal point in your head. 1, 2, 3, 4. In your head, you're thinking in 4 counts and then out 4 counts. So you have your focal point, you're breathing in 4 counts, you're breathing out 4 counts. You are staying calm, collected. One thing that I see a lot also is screaming. You also do not want to be screaming because screaming naturally constricts the body. I understand when you're pushing, you know, sometimes you might have to have a little bit of that oomph with the pushing, but you do not want to be screaming as well. So that really helps. You can also do Kegel exercises, helps to kind of stimulate the cervix as well. Pretty much if you don't know the muscle to use for your Kegel exercises, let's say you're peeing and you stop the pee, that same muscle that you are using to stop the pee is the same muscle that you can use for your Kegel exercises. So you can start out with holding that muscle, let's say 4 seconds, and then let it go. If you're good with that, you can do like 10 repetitions of that, and then you can hold it for longer. Let's say, 6 seconds, and then next time you can hold it for a little bit longer as well. Those you can actually do during your pregnancy, gets your body ready for labor, and then after you can do it as well to kind of help with that post-delivery, sneeze and you pee a little bit situation that happens with a lot of people after delivery. So Renata, to answer your question, exercises that are good to stimulate dilation. We talked about Kegels, we talked about breathing exercises, staying calm and not being stressed out, not using too much of your energy. Another thing with oxygen as well is when you're breathing well, it's not only breathing well for you, but it is also breathing well for your baby. So breathing exercises are not only for pain management, but it is also for the baby. That's why, let's say your baby's heart rate starts to drop. Sometimes they'll put you on your side. That helps to oxygenate the placenta a little bit. And they might even put on a face mask as well. That is not necessarily to oxygenate you, although it does help, but it also helps to put some of that oxygen into your baby. So that's why they might end up having a face mask. So we talked about dilation with cervical exams. We talked about ripeness. Now, effacement is how thin. Between 0 to 100 is how thin. So if they say, oh, you are 75% effaced, your cervix is nice and soft, and you are 4 centimeters dilated, that means that you are probably in active labor. It might be a little bit until your baby comes, but at least you are in active labor. Then there's station. That's the position of the baby in pluses and minuses. 0 means the baby's engaged in the pelvis, the baby's ready for delivery, and then negative means the baby still has some time to go. You have not yet really engaged in the pelvis. And then positive numbers means the baby's coming fast. So if they say the baby's at +2 station, that means the baby's pretty much right there. Then there's the position. Is this the head first or is this the feet first? If the doctor does an exam and is feeling in its feet first, that might be an indication for a C-section. For those types of exercises, Kegel exercises, you can do during your whole pregnancy. That is completely up to you. As for at 39 weeks, you are fully term. So if you have not delivered by 39 weeks and you're like, all right, let's get this baby out of me, you can start doing Kegel exercises more frequently. You can also do other things that there's some things that I don't know if they're myths or what, but I know that some people even say that nipple stimulation helps because nipple stimulation helps to release oxytocin. So that does help as well. So nipple stimulation helps, and then intercourse sometimes as well, just because, especially when you are relaxed. So those are just different things that can help you. But you do not want to start stimulating contractions. You do not want to start stimulating labor until your body is ready for labor, and your baby also. So 39 weeks, anything before that, you do not want to be stimulating your body too much and stimulating labor. So when you get towards that 39 weeks, you're like, all right, let's do this. You want to start walking, drink water, drink fluids, try to calm the body down. You can listen to classical music. That also helps as well. So position of the baby, yeah, anytime. That's why I'm here. Anytime, if you have any questions, ask away. Then there's the position of the cervix. The cervix moves from posterior to anterior as you progress through your labor. And then there's different stages of labor. So let's say you get to the hospital, you are in early labor. And then let's say you're 3 centimeters. But, time progresses, you walk a little bit. So this is what'll happen sometimes, just to know, because someone will say, how do I know to go to the hospital? If your contractions are regular, if your contractions are intense, if your water broke already, If you have, especially if you have complications, you don't feel the baby move as often. That's another reason that you would want to come. But keep in mind, as your baby gets bigger, sometimes your baby does not move as often as your baby moved before. So that is normal as well. But still, it's better to be on the safe side. Sometimes what they'll do is they will bring you into the triage. They will attach the monitors to you. They will try to see how the baby's doing. They'll try to see any contractions that happen. Then they will do a cervical exam. If, let's say you're in 3 centimeters, you're not really in active labor, they don't know if you're in active labor yet, they might send you walking for a little bit. They'll see if anything progresses, if anything happens. They might give you an hour or so. If there's no change that happens after that, then they might send you home to labor at home. If you are considered an active labor, let's say they start seeing contractions on the screen, or if they put the baby on the monitor and the heart rate starts to drop, or if, they think that you might start, getting up and moving soon, they'll probably admit you at that point. It is good to know your insurance as to, if you come just for a labor check, how much would you expect to pay? Because some insurances will treat a labor check as an ER visit, and other insurances will have just a simple copay. So that's one thing to know also, just because if you have a labor check and it's not really necessary to come, would it have been better to go to your doctor's office? Because doctors can also check. So actually for me, my insurance treated labor checks as an ER visit. And I was like, I don't know if I want to go and get charged $250 for a quick labor check. So what I did was, actually my doctor, he worked with me. He was like, all right, if you feel like you are in labor, let's go to my office. They actually had ultrasound there. He checked me and saw how I was progressing. And then when he thought that I was ready to go, he was like, all right, go ahead. Or actually with this time around, he even was like, hey, why don't you walk around first. And then when you feel like your labor is a little bit closer, your contractions are closer, go ahead and make your way to the hospital. So that's what I did, and it works for me very well. So those are just different stages. Stage 2 is pushing. So that's when you are getting ready for delivery. Pushing can last anywhere from a few pushes to even an hour, sometimes even longer. Sometimes you might even start pushing, and then all of a sudden they're like, let's give a little bit of time to rest and then start pushing again. You need to really conserve your energy, because let's say you're pushing a lot, you're using up all of your oxygen, and then the baby's heart rate starts to drop. They don't want to see that either. So sometimes if it's taking a while, they might end up having to let you rest and then try pushing again. And every pregnancy is different. For my first, I was pushing for a good 45 minutes. It took a long time. With my second baby, I didn't even know the baby was out. I was getting ready to push again. We were pretty much just starting pushes, and we pushed. I was getting in my head, all right, it's time to start pushing again, preparing myself. And they're like, oh, look, the baby's here. And that was it. So every baby is different. Stage 3 is delivery of the placenta. So with every baby, you will have a placenta. If you have twins, usually they'll have 2 placentas. So that's another thing to think about. Once the baby is out, that does not mean that you are done pushing anything out, although the placenta is not nearly as much pushing as a full baby. But let's say your baby comes out, you will feel, some gushes as well as the baby comes out, then your placenta will come out. If you were planning on saving your placenta, some third-party companies will come and collect the placenta for you. You will want to make sure that your healthcare staff knows that, so that they send it to the appropriate parties. I know that with cesarean births or with vaginal deliveries that had complications, they might want to send your placenta for pathology first. So that's another reason that you definitely want to make sure that your healthcare team knows if you want to keep it for whatever reason. And reasons change. Some people want it to plant a tree. Some people want it for pills, and some people want it for other reasons, or some people even want cord blood. So if you are the type that you want to save some of the cord blood you always want to let your healthcare staff know. And then the golden hour, that is that first hour after delivery. There's a lot of stuff going on. There's a lot of transitions going on. But one thing that you definitely want for that golden hour is you want to make sure that you do skin to skin. That's number one, is you want to make sure that you're skin to skin with your baby. And number two is you want to make sure that if you are planning on breastfeeding, that you start your breastfeeding as soon as possible within the first hour of life. Now, I do have personal consultations. You can either email me at mommydidyouknow@gmail.com or on mommydidyouknow.com under the consultations tab, you will be able to set up a consultation. Now, what I am doing that I'm just starting now actually is I'm having a free introductory consultation similar to, let's say you're picking your pediatrician and you want to know about your pediatrician before making a decision if you would like to pick them or not. So I just started doing that out of request. So on the consultations tab, I now have a section where you can actually schedule a free introductory consult with me by phone. So let's say you're about to deliver and you want to talk about your childbirth planning, or you would like to get ready for your breastfeeding. And before making a decision, if you would like to choose me, you want to just get to know me a little better. We can chat on the phone. We can talk about our values and everything. So the golden hour can last 3 hours, and we should avoid the routine procedures with the baby during that time. Is that true, Renata? So as for the procedures that you choose after your baby is born, that all depends on you. I know that some people do prefer to wait a little bit. However, think about the benefits and the risks. So for certain things such as the vitamin K, the research has shown that the vitamin K is most effective within that first hour of life. So for sure that vitamin K, I would make sure is within that first hour of life. We normally in the hospital, we do the hepatitis B vaccine and the erythromycin ointment within the first hour with the vitamin K. If you want to delay them, that is up to you. However, it's very, very small procedures that don't normally pay too much of a difference in their transition. However, it is not my baby, it is your baby. So it is all your decision about how you would like to do things. I have sometimes transition babies where let's say a baby was born and mom wanted to complete her first breastfeed before she had all of the vaccines and everything like that. And she wanted to do skin to skin. We've actually delayed weighing the baby, and we've delayed doing the measurements, and we delayed doing those vaccines until mom had her skin to skin time and she did her first breastfeed. If that is your decision, that is perfectly up to you as well. All of these, we are just guidelines for you in the end. So everything is pretty much all up to you. We just give you the education that you need, and you make decisions as you need. So my recommendation, remember also, I am a nurse as well as a lactation counselor. And I do recommend, I don't know what to do. Yeah, I completely understand that. I do recommend, as the Academy of Pediatrics recommends, CDC and along with other organizations, World Health Organization, to give the hepatitis B, vitamin K, and erythromycin within the first hour of life. However, I do accept that you might want to do skin to skin, and you might want to breastfeed without that first interruption. In that case, I do not think that it is too much of an issue, but I would definitely try to get those procedures within the first hour. However, if you did want to do your first breastfeed before that, that won't really make too much of a difference. With my kids, I did my skin to skin. I said hello, and then as they were, stitching and, getting everything squared away with me, they did their measurements and their weights and all of that good stuff. I'm happy that I was able to help you with that. So I know that we are almost out of time. So for those of you who were able to watch, I am so excited that we had the opportunity to meet with each other. I am so sorry about the technical difficulties in the beginning. Just bear with me sometimes. My technical expertise is not exactly 100%, but at least we were able to get this video squared away. So you guys can also schedule consultations with me on the consults tab on mommydidyouknow.com. You'll be able to schedule, or you can even email me at mommydidyouknow@gmail.com. I do now have that where you can have the introductory consultation if you want as well. That's 15 minutes. We can talk about, what your goals are, what my values are, what your values are, and make sure that they mesh well. I also have the Childbirth Masterclass online. So to give you an idea of how much information is on the Childbirth Masterclass online, this is probably like the amount of 2 lessons in the 30 lessons that are, well, actually there's 26 lessons in the Masterclass online, and that's on my website as well. And do you guys have any questions before we end this class? I know that we talked about a lot of stuff. We talked about pregnancy, we talked about labor. I know that we talked about a whole bunch of different goodies, but if you guys have any questions at all, or if you guys have any questions for me privately that you don't want to share in front of a live chat, that is perfectly fine as well. I would be more than happy to answer. You can just give me, my phone number is on the website as well. My email address is on the website as well. And you can also sign up for my classes. I do have free ones in addition to premium ones. So, I have a lot of resources on the website that are not necessarily resources that you would have to pay for. I do have a lot of free ones because I know how it is, especially now with everything going on with COVID. My first and foremost is I want to make sure you guys have the resources available to you. So it was a pleasure. I will be ending this class now. I hope you guys have a wonderful rest of the day. And yes, I'm so happy that you loved the class. And I hope you guys have a wonderful rest of the day. And I hope that we can continue stay connected. You can connect on the website as well as on the Instagram. I have a whole bunch of different things. So if you guys have any more questions, you can let me know. If anything, yes, I'm so glad I got to meet up with you guys, and have a wonderful, wonderful rest of your pregnancy. I wish you all the